What effect does healthcare have on our economy? The health sector accounts for 1 in 9 jobs nationwide. In many rural areas where economies are smaller and less diversified than cities, the impact of healthcare spending is magnified. The number of employees in healthcare is equal to the employment in retailing and manufacturing combined in many counties. The healthcare industry has become a constant job producer of doctors, nurses, paramedics, medical technicians, administrators, and healthcare aides. The Affordable Care Act, enacted in 2012, created at least 500,000 jobs, according to an analysis by Goldman Sachs. Social Security recipients will be getting a 2% cost of living adjustment, or COLA, in 2018, the largest increase since 2012. But it won't be enough to keep pace with the rising costs of older voters who depend on the monthly benefit as their prime source of retirement income. Now let's look at the economy as a whole, and we'll see why these earlier numbers are important. Real wages for workers have been falling slowly but surely in America for 40 years. The cost of living continues its upward climb, while globalization forces American workers to compete with the low-paid labor in other parts of the world. Almost all the jobs created since 2005 are temporary. Half the jobs in America pay less than $18 an hour, and 75% of American families earn less than $100,000 a year. In the current economy, the 3 largest types of employers are military, retail, and food service. And note, retail and food service sectors will lose many jobs. Half of American working families are living paycheck to paycheck. Incomes generally are not increasing fast enough to match rising household costs. 59% of American manufacturing jobs could be automated in 10 years. 90% of welders, cutters, and solderer jobs. 73% of food service jobs. 53% of retail jobs. And 43% of finance and insurance jobs could be automated in just 10 years. Automated jobs are why some leaders like Mark Zuckerberg and Elon Musk talk about a universal basic income. Healthcare costs older people more proportionately. According to one pension advocacy organization, nearly 1 million working and retired Americans are covered by pension plans that are at the risk of collapse. With only a year of college and sometimes less, work can be found in the medical field. Here we see a chart I've created of health jobs, and they'll be among the best available jobs in the emerging economy. And they start with anesthesiologists on the left, cardiovascular technologists, chiropractors, and going down through over 50 occupations, including veterinarians, veterinary technologists, and laboratory animal caretakers. In 2015, U.S. healthcare costs were $3.2 trillion. That makes healthcare one of the country's largest industries, equaling to 17.8% of the domestic product. In comparison, healthcare costs $27.2 billion in 1960, just 5% of GDP. This translates to an annual healthcare cost of $12,850 per person in 2018 versus just $146 in 1960. Healthcare costs have risen faster than annual income. Over 51 years, the compounded annual increase in Medicare premium cost is roughly 7.7%, which is consistent with high medical care inflation rates, making Medicare for All, with its low overhead, the most cost-effective solution to climbing healthcare costs. The health of the American people and the economy depends on a healthy health sector.